Ontario's basic income experiment has come to a halt, but the dream of a program that would provide everyone with a living wage, no strings attached, lives on for many people. In fact, a new book lays out an argument for a national basic income project. It's written by Evelyn Forget, an economist at the University of Manitoba who's been researching basic income for over a decade. It's called Basic Income for All Canadians, the Key to a Healthier, Happier, More Secure Life for All. Evelyn Forget, good morning.
Good morning.
It's really interesting that this book is coming out not long after we here in Ontario got the news that our basic income experiment was cancelled. So people who are studying this, because I know Finland has done a similar experiment. I mean,
That's right.
How did other parts of the world react to this?
Well, there was outrage. I think in the first instance, people were really quite stunned that the cancellation could be announced without any concurrent statement of how the participants would be weaned off the additional funding. I mean, everybody who agreed to open their lives to researchers thought they were being promised 3 years of basic income funding. They made long-term decisions, and then suddenly they read in the press that the experiment's been canceled, and they have no idea of what's going to happen to them. And in fact, it took the government of Ontario a good month to make the announcement that their payments would at least be continued until next March to give them a little bit of time to make arrangements.
Yeah.
So that actually caused a good deal of upset because most of the people involved in experiments are researchers who are used to working under the auspices of ethics boards. And, that's not really the way you deal with participants in research projects.
Yeah, and you've been studying basic income for more than a decade now. I mean,
that's right.
Why are you so convinced it's the right way to go?
Well, I'm a health economist. I actually have my office in the Health Sciences Center in Winnipeg, which is right in downtown Winnipeg, and it's a fairly challenged part of the city. The Health Sciences Center deals with a lot of low-income folks from the neighborhood. We also treat people who travel from remote communities in Manitoba. And you don't really have to spend a lot of time walking through the halls of an urban hospital to realize that a lot of your health care dollars are going to treat the consequences of poverty rather than poor health. People are in the hospital, not because they have bad genes or, because they were in terrible accidents, but by and large they're there because they've lived some really hard lives. They've dealt with the consequences of poverty for a long, long time. And it's hard not to ask yourself whether it wouldn't make more sense to put some of those dollars up front, to give families the resources they need to provide for themselves, and to stop spending quite so much money after the fact trying to deal with the consequences of poverty, just to reallocate that money a little bit. And so that's what really started me off. I wondered whether if we dealt with poverty adequately, we would actually see consequences in terms of the health of individuals. So I went looking for the data that was associated with an old project that took place in Canada in the 1970s called MINCOME. And I finally was able to track down some of that data and to reanalyze it. And what I suspected turned out to be true. If you give people a basic income, you find them spending less time in the hospital. And when you look closely, you find that a lot of those reduced hospitalizations are due to the fact that people have fewer mental health challenges. And so that's really what started me on the trek for basic income. And the more I learned about it, the more I recognized how limited some of our existing social programs really are.
Mm-hmm. And, I'm thinking the 70s to 2018. I mean, the labor market has changed so much, too.
Absolutely. And I think now we've got even middle-class jobs turning into very precarious forms of labor. If you think, I'm a professor, and, I have one of the last sort of rock-solid jobs in the world, a tenured professor at a major university, but my students are graduating, and they're not getting jobs like mine. They're getting jobs that pay them $5,000 or $6,000 per course, and they find themselves traveling between 2 or 3 universities, finding out 2 weeks before term starts whether or not they've got a class to teach that term. And, that kind of precarious employment for really highly trained individuals, it has consequences. It has consequences for their families, for their health. It's not something you can do for the long term. So those kinds of changes that are occurring more and more in the labor market, I think, really bring home to us some of the limitations of our existing social programs, which were really built for a different kind of a world.
And the big question, and it's always the big question when we talk about this, is can we afford it? So what's your argument that we can?
Well, I think the Parliamentary Budget Office, which is the organization that keeps governments honest, that puts a price on all of the promises that our various governments make at various points, did an analysis of basic income in November. They were asked what the cost of the Ontario scheme would be for Canada if it were introduced nationwide. Mm-hmm. And they came up with a gross cost of $76 billion a year or something, which is horrendously large. But then they reminded us that the federal government already spends quite a lot of money in support of low-income people, and if you fold some of those programs into the basic income, we end up with a net cost of $43 billion a year. And that doesn't take into account the $20 billion a year that the provinces are already spending on income assistance. So if somehow that money could be reallocated to the basic income, we end up with a net cost of $23 billion a year. And that's a really interesting cost because that's exactly how much we spend every year on our Canada Child Benefit, and we find ourselves quite capable of paying for that. It's really quite a small portion of the total budget of the federal government. And that doesn't take into account any of the savings you might find in other social programs. As I said, if we put fewer demands on our healthcare system, we might see healthcare costs increasing at a slightly lower rate than we've been watching.
It's fascinating, isn't it?
One of
the chapters in your book is the 9 myths about basic income. And what's the biggest one in your mind?
Well, I think there are 2 big ones. We just touched on the one, and that is that it's so horrendously and outrageously expensive we can't talk about it. But I think the one that keeps coming back is that if we offer people money for nothing, if we give people unconditional money, they'll simply stop working. And when we actually look at the empirical evidence, we find that if people are given an unconditional basic income, they don't work less. In some cases, they actually work more, or they find themselves in better jobs over time.
Do you think it's inevitable, though? I mean, will we come around to accepting basic income as a fact of life?
I think so. It's always hard for any society, I think, to make big changes, and there are always political challenges. But I think there are several factors pushing us in this direction. The first thing we can look at is the fact that we've already got a basic income in Canada for 2 really significant groups of people. The Canada Child Benefit is, in fact, a basic income for families with kids under 18. The OAS and Guaranteed Income Supplement for seniors is a slightly different form of basic income for people over 65. And I think what the Ontario experiment was trying to do was to extend those same ideas to adult benefits, to people between the ages of 18 and 64, and to see if we couldn't offer income assistance or a better kind of a social program than the existing programs that do such a terrible job of helping people emerge from poverty and do an awfully good job at keeping them there.
Keeping them there, absolutely. Evelyn Forget, thank you so much for your time. Really appreciate talking to you this morning.
Well, thank you very much.
Evelyn Forget is an economist at the University of Manitoba. The book is called Basic Income for Canadians, The Key to a Healthy, Happier, More Secure Life for All.